Well, this morning we're checking in with the MetroHartford Alliance once again. We spoke about the Connecticut Health Council's D.C. forum before the group left. Today, Griebel, the president and CEO of MetroHartford Alliance, is back with us, joining us to tell us how it went. I was telling you before, it's been a while since I've seen you.
It's been a while, Tim.
Good to see you, Mr.
Delighted to be here. Thanks for having me.
Well, okay, well, tell us about the Health
Well,
Council.
the D.C. Forum is the second one we've done. The Connecticut Health Council was formed about 5 years ago. It was modeled off something we've seen in Nashville, and it really is about pulling or trying to establish more collaborative action among our significant base of healthcare assets. That's the hospitals, the 3 medical schools, the dental school, all the health insurers that have major operations or headquarters here, the providers, to see whether we can leverage that asset base to not only strengthen employment and capital investment in the health sector, but to position Connecticut, position our health sector as a competitive advantage for any entity that wants to come here, because we'll be able to demonstrate that we can provide the most affordable, accessible, highest quality health care to everyone. And so the forum was an attempt to listen to folks on Capitol Hill, on where the repeal and replace is, to talk about, we had people from Nashville in to come and talk about where they are today after 25 years, and then talked about, had a number of folks in the final panel from Connecticut positions, health providers, the state, about where can we find some collaborative opportunities.
I imagine if you're trying to sell this state, you want to find an industry that you think is going to be stable for a long, long time.
Correct.
And that's one of them.
And that's one of them. And in addition, Tim, the sector is we're proximate to the Boston and New York health sectors, which are obviously very robust. They're large. So selling to Connecticut as part of that corridor is a very important part. One of the panelists, a gentleman by the name of Bobby Frist from Nashville, we asked him what advice would he give us. And an interesting comment. He said, run to something that everyone else is running away from to be your center. So that was one of the things that we're having. We'll have a forum on November 9th down on the AquaTurf to follow up on what we did in D.C.
Yeah, what do you want to talk about in that one? I mean, what are some of the more specific
Well, I think what we
ideas?
want to take is the learnings and the questions and the themes that came out of D.C. and then come out with some collaborative action. Things that we're talking about. Are there some opportunities, for example, just looking ahead to the 18 legislative and gubernatorial races? Should the Health Council take particular positions that we would want reactions from candidates on? Are there opportunities with the federal chaos around, particularly with the repeal and replace essentially dead? What the impact that could be on Connecticut, and can we take advantage of that chaos to find a niche by working together more collaboratively to position Connecticut as I said, in that competitive advantage?
Yeah, sometimes when there's uncertainty, that's an opportunity.
There's no question.
To sort of get in there and try to drive the bus and get everybody pulling in the same direction. Good to see you again.
Always a pleasure, Tim. Nice to see you.
Let's get you back once again with the MetroHartford Alliance.